Hello everybody, this is Paul from Ortho Eval Pal. I want to talk to you today about MCL injuries, and today we'll show you a little evaluation on somebody who has had an MCL injury. So this gentleman here is 53 years old and about 1 month ago was in the ocean in Hawaii, took a wave, kind of struck him, his knee went into valgus while his foot was planted, and developed some medial joint discomfort, had some stiffness overnight, stiffness the next day, felt a pop when it happened, and so just kind of continued to hope it would get better. He went to see his family physician and was referred to us. Now, upon evaluation of the patient, we noticed he did not have a flexed knee posture when he walked in. Okay, so the next thing I look at is, does he have any synovitis or inflammation around the knee? And I don't feel any warmth to his knee. When I look at it and I do a brush test, I notice that he has no intra-articular effusion. So we can rule things out like meniscus, ACL, PCL, fractures and things of that sort. The other thing that I look at is if he has an intra-articular problem and he has an effusion, the knee will kind of stay in a flexed position. I don't see that. I can extend him very well. He has no problem there. And we can flex him without any trouble. He's able to perform a quad set. Go ahead and tighten up that muscle. And he does fairly well with that, but it's slightly suppressed. Okay, he has a little discomfort when he gets into full active extension. He's able to point to the medial aspect of his knee. So we need to be considering several things. Is it a meniscus? Is it a medial capsule? Is it a MCL, a medial collateral ligament? It could be any of those things. He could have a hamstring strain. Okay, so after doing that, we checked his ACL, so we did a Walkman test. So relax your leg. Knock, knock, knock. A really nice endpoint here. It's nice and clean. We do check his PCL. No instability posteriorly. When I check his medial meniscus, I put him in a little bit of varus and I flex and I extend him. No significant popping or locking, no significant pain with that. Okay, so the next thing I do is I do a valgus stress test to check his medial capsule at full extension. And that can also affect the meniscotibial ligament when you do this. And that you feel a little bit of discomfort with, correct?
Yeah, not too bad.
Okay, and then right over here I flex him to 20 to 30 degrees. I do another valgus stress.
Yep.
Oh, he doesn't like that. And his pain is right in this area. So then what I want to do is palpate to see if this is meniscal or not. So no tenderness in the joint line until I get to about here. Okay. And then if I follow that medial collateral, he gets real tender here. Okay. And then I go down, follow him down here, a little tender there also. So that tells me it's more MCL than it is meniscal, because meniscal will follow that joint line and not be painful above or below. So his swelling is extra-articular. He has good extension, no flexed knee gait, negative brush test, and tenderness with a valgus stress test at 30 degrees, and also pain to palpation. He has a MCL sprain. Now, I don't notice a tremendous amount of instability there compared to the other side. So all we're going to do is we're going to put him in a double hinged brace with a 20-degree extension lock, so he doesn't fully extend for about a couple of weeks, and we're going to keep an eye on him, get his quads functioning well, and then bring him to full extension, and he'll wear this brace just to prevent valgus type stresses to his knee for the next month or so. But he's going to do very well. He's a strong guy, has been a very compliant patient in the past, should progress really nicely. So if you have any questions, get in touch with me on orthoevalpal.com. Go to our Get in Touch page. Shoot some questions or comments about this video, and make sure that you subscribe to our channel so that you can see other videos like this in our playlist when they come out. Thanks.